Stakeholders and civil society organizations are urging the federal government to increase spending on healthcare in order to combat the spread of malaria, particularly during the rainy season. Chinemi Bameyi has more on this report.
The World Malaria Report of 2022 shows that Nigeria had the highest global malaria burden at 26.6% and deaths at 31.3%. With the rainy season in full swing, Nigeria is once again facing a surge in malaria cases. This has prompted stakeholders and civil society organizations to call on the government to increase its spending on healthcare with a specific focus on rolling back malaria.
When you are no more there, what will they remember you for? In that your local government, that your organization, what will they remember?
They urge the government to complement efforts of donor agencies by prioritizing healthcare spending and allocate adequate resources to combat malaria effectively, especially funding for mosquito control programs, distribution of insecticide-treated bed nets, to diagnostic tests and anti-malaria medications. Malaria remains a major public health challenge in Nigeria, and these groups argue that additional funding is crucial to providing better prevention and treatment measures.
As far as the state is concerned, we are here to get a budget line, a dedicated budget line for malaria. We still make use of the lump sum of public health budget lines for malaria. And when you're talking about public health, every public health issues lies in that department, COVID-19 and every other things. And if you remember, during COVID-19, they crashed all the funds made for public health to tackle COVID-19. Whereas, assuming you have a dedicated budget line for malaria, they can't touch that. It will be used specifically for malaria.
See how we can deliberately have that plan to capture specific data on the cases treated, the people who have referred, and the impact we have gotten, the focus group discussion, the number of women we have reached.
Consequences of insufficient healthcare spending are evident in overcrowded hospitals across the country, where health workers are stretched thin and resources are scarce. With a significant increase in funding, these hospitals could be better equipped to handle the influx of malaria cases during the rainy season. Chinemi Bameyi, TVC News, Mina.